Welcome back. The CDC says ovarian cancer is the second most common gynecologic cancer in the United States and the deadliest. In 2020, there were more than 18,000 new cases. Joining us today is Dr. Michael Gold, a gynecological oncologist at the Oklahoma Cancer Specialists and Research Institute. Thank you for being here.
Thank you very much for having me, Rick.
Well, first question is, how important is it to get screenings for cancer?
Cancer screenings are incredibly important. Finding cancer either before it occurs or at an early stage is imperative in improving survival. It's really important for things like cervix cancer, breast cancer, colon cancer, but not, unfortunately, for ovarian cancer. We at present just do not have adequate screening tests.
But of course, it's probably being worked on, trying to figure that out.
Of course.
Is there an age group that's most affected, or if not, what other risk factors are there?
Sure. Well, the typical cancer that we talk about, epithelial ovarian cancer, or cancer that starts on the surface of the ovary, occurs on average at age 62. So as a woman ages, becomes late in her reproductive age, or becomes menopausal, that's when she's a particular risk. Some of the risk factors include not having ever had children, or having very few children, and especially having a family history of either breast or ovarian cancer.
Is there some symptoms to look out for? I mean, everybody wants to know that. And also, when should you see a doctor?
Thank you for asking. The symptoms, unfortunately, tend to be somewhat vague and are general digestive disturbances, so bloating, belching, feeling like your waist size has increased, maybe a little nausea or loss of appetite. What's important to know, though, is if a woman has felt like that for years, it's probably not ovarian cancer. But if someone is feeling well, they're in their normal state of good health, and all of a sudden start to notice a change in the way they feel and start to develop those symptoms, they ought to see a physician right away.
Now, we know cancer treatments across the board have come a long ways. What options are there for ovarian cancer?
Yeah, so if it's caught early, and as we say, hopefully we can, then sometimes surgery alone is all that's needed to cure the cancer. In most instances, however, surgery is followed with chemotherapy, and fortunately the chemotherapies that we are able to use for gynecologic cancers and ovarian cancer in particular tend to be really well tolerated and are becoming more and more effective.
So it's more of one of those things that, or I guess, how successful has it been overall, the treatments?
It has really improved greatly, and now more than half of our patients with advanced ovarian cancer are alive 5 years later. We've developed not only the initial treatment, but there are now a number of drugs that we use for what's called maintenance therapy, and that is designed to help maintain the remission and improve cure, and they tend to be things that are really well tolerated that somebody can take for long term.
Now, we hear a lot about breast cancer awareness and other kind of cancers. How important is it to raise awareness through your job or through anything for ovarian cancer so women, aren't caught off guard?
Well, I think awareness is essential in order to detect this at as early a stage as possible. Since we don't have a screening test like a mammogram for breast cancer, it's really important to get the message out to women that if they do start to have any of these symptoms, most likely it's not ovarian cancer, but if they do feel this way and it lasts more than a week or two and it's not the flu, go see your provider and hopefully they'll work this up, and if there is an abnormality found, send them to the appropriate specialist who can take care of this.
Great information. Dr. Gold, thank you so much for being here. We appreciate you.
Thank you. I appreciate the time.